Hello and welcome to our short video on hearing loss. This short presentation will introduce the Audiology Tayside Specialist Adult Hearing Clinic and lay out some important information about your journey so far and some of your options going forward. Hearing loss for most people is a gradual progression, but if you experience a sudden or very rapid loss in 1 or both ears, then you may have a condition called sudden sensorineural hearing loss, SSHL. This is a serious condition that can affect anyone of any age, regardless of any previous hearing issues, and needs to be treated as a medical emergency. As the name suggests, SSHL is a sudden drop in hearing within 12 hours or less. Some people notice a pop before their hearing drops, or it can deteriorate noticeably and very quickly. It is not uncommon to wake up to the condition. The key thing is to recognise your hearing loss is not normal and seek urgent medical care from a hospital emergency department and ask to see an ENT specialist. As sudden hearing loss is invisible, it can be very frustrating to convey to doctors at the emergency department how urgently you require treatment and to explain what you're experiencing. Hearing loss may be a temporary outcome of SSHL, but left untreated, it can be permanent. If there is no access to a private or NHS audiologist, then the emergency department need to take advice from an ear, nose and throat specialist urgently and discuss whether steroid treatment should be started as a precaution. Steroid treatment within 24 to 48 hours of onset is said to be around 85% effective, and acting quickly is crucial. A hearing test should be arranged as soon as possible. Some facts and figures about sudden sensorineural hearing loss. 70% of sudden sensorineural hearing loss patients also suffer from tinnitus. Vertigo is present in 50% of sudden sensorineural hearing loss cases. Incidents of sudden sensorineural hearing loss are mostly in one ear. Only 2% experience a case of sudden sensorineural hearing loss in both ears. Spontaneous recovery occurs in 32 to 39% of the cases, usually within the first 2 weeks. The chances of full hearing recovery are smaller for patients with severe loss of hearing and when the sudden sensorineural hearing loss is accompanied by vertigo. The amount of hearing loss someone has ranked as mild, moderate, severe, or profound. If you have a mild hearing loss, you tend to have difficulty following speech in noisy situations. If you have a moderate hearing loss, you can struggle to follow speech without a hearing aid. If you have a severe hearing loss, you will benefit from powerful hearing aids or an implant. Even when using hearing aids, you may rely heavily on lip reading. If you have a profound hearing loss, you will rely mainly on lip reading and/or sign language or an implant. Even when using all of these things, you still may not understand everything being said, even in a quiet situation. Recovery from sudden sensorineural hearing loss can be a distressing time, and it is important to get as much support as you can. On a day-to-day basis, coping with hearing loss can be daunting and leave you feeling very tired, as you have to concentrate so much harder to understand what is being said and navigate the world around you. If your hearing doesn't recover, you will need time to come to terms with the change. You will also need help from professionals, friends, family, and work colleagues. If your partner, relative, or a close friend can go with you to your visits to your ear, nose and throat specialist or audiologist, they can learn about ways they can make communication easier for you. Noisy environments can be challenging, as it is extremely hard to follow a conversation in a busy environment with a lot of background noise. Even if sounds are made louder, for example with hearing aids, Important sounds like speech may not be clear. With a sudden hearing loss, all of the above effects are magnified. Often your life changes overnight and the adjustments to this can take a long time. However, there are lots of practical steps you can take to get a better understanding of what you're going through. We will discuss all of the relevant support you can access to make the most of your residual hearing. Hearing devices focus on restoring the sensation of hearing. You can be fitted with up-to-date hearing aids. You can access lip reading classes. You can choose to use good communication tactics. You may choose to look into specialist equipment for the hard of hearing, which can be used alongside hearing devices. You may choose to contact rehabilitation groups or charities for the hearing impaired. You can provide more information, advice and support. You may be suitable for cochlear implant or bone-anchored hearing aid referral, depending on your hearing loss. You may choose one or a combination of these options, which can all be discussed further with your audiologist. There are considerations to be made when thinking about your hearing loss. If steroid treatment does not fully return your hearing, then there are options you can consider. If hearing aid technology is chosen, you will be made aware that there are some limitations with this technology. Hearing aids cannot replace normal hearing as they process and amplify the sounds around you. Technology options can be very helpful, and this can be discussed with your audiologist. Using closed questions such as, "Did you say 13, 1, 3, rather than open questions such as, "What number was that?" can help. That brings us to the end of this video on sudden hearing loss. We look forward to seeing you again on the Specialist Hearing Clinic. Please note down any questions you have from watching this video and we will discuss these with you in your next appointment.